Welcome back once again. And well, so in today's edition of the program, joining us here is our very esteemed guest, Dr. Nassif, who is a consultant plastic surgeon. And we're going to be speaking to him about the differences between cosmetic surgeries and plastic surgeries. Good morning and welcome to the Saudi Morning Show, Dr. Paul.
Thank you for having me.
It's our pleasure that you are here to join us in today's edition of the program, especially talking about a subject which is really, really hot nowadays, which is cosmetic surgeries as well as plastic surgeries. So, well, Dr. Paul, as we talk about cosmetic surgeries and plastic surgeries, yourself being the consultant plastic surgeon, tell us a little bit about some of the differences or the variations between the two.
When we hear the word cosmetic surgery, it's almost the same as plastic surgery. It really depends on what the procedures are. So if someone comes in and says, I want a rhinoplasty, which is a nose job, or an eyelid lift, or a facelift, that to me is considered more of a plastic surgical procedure. However, you can also use it as cosmetic surgery. But when we talk about the non-invasive procedures, such as facial fillers, or peels, or anything really to do with the skin, such as the application of Botox or Dysport, which relaxes some of the facial muscles and helps soften the wrinkles, those we can call cosmetic procedures. So that would be the simple. The other aspect is reconstructive plastic surgical procedures, and that's primarily a lot what I do. I'm a revision ethnic rhinoplasty specialist, which means a patient comes in, especially in Saudi Arabia. We've had many patients that have had up to 5 or 6 previous rhinoplasties, and I come in and I reconstruct the nose.
Okay. I'm sure, Dr. Paul, you've seen a lot of everything in the cosmetic surgeries. Can you please elaborate what is the most surgical and non-surgical cosmetic procedures that you have performed?
Let's talk about the Kingdom of Saudi Arabia, and then we'll compare that to the United States. Since I'm a facial plastic surgery, the most common invasive or surgical procedure I perform out here is rhinoplasty. And I noticed that, especially from the teenagers on up, get surgery out here on the nose. And a lot of it is mostly reduction of the hump. Okay. And that is the most common procedure out here, is that I've seen. From the non-invasive surgical procedure, I've seen more of facial fillers and the use of Botox or Dysport. So when I say facial fillers, if someone comes in and they want to have the smile lines softened, if they want to have the lips a little bit enlarged, or the biggest thing that I've noticed out here too, which we do in the United States, is filling in the lower eyes. And as we age, the fat that we have here, the cheeks start to descend and you get hollow. So we put filler in the lower eyelid area. We can fill the cheeks, we can fill the chin, we can fill the temples, we can fill around the eyebrows to elevate. So you can do all types of things with fillers. And then obviously with the what we call neurotoxins, such as Botox or Dysport or Xeomin, these are different products. You can soften the lines between your eyes, forehead, what we call the crow's feet. We can even get little bunny lines on the nose. We can do all types of things, even improve the neck muscles. So that's the most common.
Indeed. And Dr. Paul, as you were just mentioning about some of the teenagers even coming up to you, and we get to see that in lots of the different parts of the world, sometimes some of the doctors, let's say, who are not really into good practicing, would not really turn away a patient because a patient is a client that you do not want to turn away because you don't want to lose him. Now, how important are some of the medical ethics that would tell you that this person is too young to be operated on or to be dealt with? How is it that you determine your patients?
Okay. So now we'll talk about the United States for this, since this is a very, very touchy subject, and I lecture on this all the time, especially, right now we're currently filming a new TV show for E! Entertainment. It's called Botched, which means I'm fixing other bad plastic surgery. And some of that plastic surgery was performed on patients that were too young. So in general, let's talk about females. Females mature a little bit physically faster than males. And the youngest that will usually operate on a nose is 15 years old for a female, the youngest, and 16 years old for a boy, as long as they are pretty much finished with the growth spurt.
Okay.
However, then we have to find out what is the reason. If the patient comes in and let's say, for example, they have a large nose and the chin is set back too far and they've been getting teased and they're getting a problem with their self-image, and the parents support the child for having surgery, and there's realistic expectations, and this is, doctor, they'll say, this is why I want to have my nose. One, I can't breathe, maybe. I have a problem breathing and it hurt, and it causes problems with exercise. Two, I can't stand this hump. It's been bothering me since I was a little child, and I get made fun of all the time. These are okay reasons as long as we sit and we talk about the psychological aspect of the long-term effect of having plastic surgery. Also, they have to be healthy. And so we also will take that with all patients, whether they're 20, 30, 40, 50, to make sure they are realistic and they don't have something called body dysmorphic disorder. Now, body dysmorphic disorder, and we have seen patients, especially if they're raised in a household where there's perfectionism, and you have to be the best in everything you do, and if they basically come in, let's say the nose or the face is perfect, but they think it's horrible, these are specifically patients that we don't want to operate on. So the doctor has to use their best judgment to do no harm, physically or psychologically. Very important.
A lot of the patients that come to you and they say they're not happy with themselves,
Yes.
but they're absolutely beautiful. Say some of the women. Do you go ahead and try to inform them as to get the actual rules? Say maybe they're bullied because another lady is jealous of her or something like that? And then do a lot of the patients, do they get turned away, or at the end they become convinced that it's unnecessary?
Okay. So about 10% of my 10% of my patient population, we don't perform surgery. And I will sit, because a lot of my practice is the first part, sitting, listening.
Of course.
And the number one thing I do, I work with different psychologists and psychiatrists in my practice. And what we will do is we will say basically, you know what, I recommend that, I feel that you have depression. I feel that you have body dysmorphic disorder, and I think that it would be best for you to talk to someone about what's going on in your life. And once you improve these aspects, then maybe we can come back and revisit it. And everyone in my practice in Beverly Hills, before they have surgery, I have an in-house psychologist who has to screen the patients to make sure they are completely qualified psychologically before they will have surgery.
Because I'm sure a lot of them, they're depressed, they want a new change. So they believe that by changing themselves from the outside, they'll be able to change themselves from the inside.
And that's the mistake. But I will tell you, sometimes, let's say you're in your 40s and you went through a divorce. And you have always hated something. Let's say you have heavy eyelid skin.
Okay.
Sometimes when you do that and you take care of the eyes, they will feel so much better about themselves, other things will change. However, that's more of the minority. We want to first take care of the inside, then go to the outside.
Of course.
Indeed. Now, Dr. Paul, as we talk about cosmetic procedures and plastic surgery, and as you were speaking about the differences between the two, tell us also about what are some of the procedures and what kind of anesthesias would they require? Because we get to see lots of the people do not have the fear of surgery, but they fear anesthesia.
Yes.
So tell us a little about it.
Okay. The non-invasive procedures, first of all, that you'll have in the office. And there's different types of facials. There's different types of lasers that you can have in the office, and we put cream on your face. There's ways to tighten up your skin, remove acne, hair removal. These are more of the dermatologic procedures that the dermatologist will perform. The plastic surgeons and the dermatologists will perform, as I mentioned earlier, fillers and the injections to relax the muscles. That is done in the office with no anesthesia, but maybe some numbing cream. Now, when it comes to surgical procedures, we do a combination of procedures under what we call local anesthesia, which means they'll come in and maybe they might take a little pill called Valium or Xanax to relax them. And you can do many procedures. I'll do facelifts, where I'm lifting up the face under local anesthesia if the patient...
This is the one in which you insert something from the side?
No, this is where actually you are cutting all the way around the ear and back behind, and I'm elevating the face. And everything has to be natural. You can do that under local, or you can use anesthesia with the anesthesiologist. We can take off upper eyelid skin. We can take the fat in the lower eye and do something called fat repositioning. We can put in a chin implant. We can do liposuction. All these procedures can be done under local anesthesia, but most patients would say, as long as they're healthy, to have the general anesthesia, or what we call IV sedation, where you're out and we're giving you medicine in your vein. When I perform brow lifts, most of the facelifts and most of the nose surgeries, most of them are under general anesthesia. And the patient has to have blood work to make sure they're healthy. They have to have a physical. If they're over the age of 50 or 55 and or a history of heart disease, we have to have a cardiologist give them a stress treadmill tester to make sure the heart is okay. It's very important before anesthesia that we make sure they are healthy. And I hope does that help? Of course.
Indeed. Well, and as well, Dr. Paul, tell us a little about how difficult could plastic surgery be on a person? How painful could it be? How long could be the recovery period?
Sure. You know, when we talk about how good could it be, the number one thing that we want to do if you have plastic surgery is when your friend comes up to you and they haven't seen you in 3 weeks, we want them to say that you look better, you colored your hair, you have new makeup on, or for a male, you know, you lost weight. We don't want people to look at you and say, you have plastic surgery, because if we have to have it look natural. The nose can't be overdone. If the face is lifted, you have to look natural. It can't be like this. It has to be like this. No scars. The eyes have to look natural. Recovery. We'd like to tell patients 2 weeks for the main recovery, sometimes 1 week. But in general, it takes up to 2-3 months for you to be perfect. And the nose, it could take up to 2 years to heal. Pain. With the face, most patients don't complain of a lot of pain. A little bit of pain medicine for 2-3 days, and usually the pain will subside. It is not that painful.
Indeed. And Dr. Paul, finally, what I would like to ask you is, how is it that people get to choose a plastic surgeon? We get to see now, this is a time where we are able to shop according to price ranges. So I want rhinoplasty. Now, there is a doctor who could be able to perform it for $10,000. There is another one who is going to take $2 grand for what he's going to be doing, and there is one who's going to take $3 grand. How is it that we are able to choose a doctor?
Well, the bottom line is experience, in my opinion. So, for me, for example, I'm a specialist in rhinoplasty. And I do beautiful face work, but what I'm famous for internationally is nose jobs. When you are famous for something, you do it all the time, obviously the price will be a little higher than someone who's been doing it for a year or two, maybe doesn't have that much experience, and it might be the 2,000 as you mentioned. The issue is you have to first find out what type of doctor. Is the doctor qualified? Let's say rhinoplasty. You want to make sure they're either a facial plastic surgeon, which is me, or a general plastic surgeon, no other cosmetic surgeons. You want those specialists. 2, you want to make sure they have a good reputation when you can check online on Google, on chat rooms. You want to go to their websites to look at their photos to see if you like it. You want to ask the doctor how many rhinoplasties they performed, what are the complications. What percent of the patients that you do a rhinoplasty on come back and need a touch-up surgery? These are very important questions. And the biggest thing is word-of-mouth referral to make sure that the doctor is well qualified. I have to tell you, it's your face, which means the price really should be secondary. You want to find the most qualified physician that will do a natural job. And remember, it's very important with the rhinoplasty. If you do too much work on the nose, take too much away, yes, it may look good for the first 3, 4, 5 months, but we're talking about long-term effects. And if you take too much cartilage, the nose may look good, but then after a year, 2 years, 5 years, the nose starts to collapse. You can't breathe well. It looks fake, like you've had too much surgery. And it's very important. 17% of patients need to come back for a revision rhinoplasty.
And
Dr. Paul, I'm sure you've seen a lot of the patients that you probably worked on, that they went to another doctor and they made a mistake because they wanted to go ahead and save their money. Your advice to that, just go ahead and just save up enough money to buy experience, not just a bargain on it. Is that correct?
Bargain should be it's not like buying a pair of pants.
Of course not.
Then you can go, the thing is, most patients, they make the mistake and they try to do the bargain, and they may go to someone who's not qualified. And that's the most important thing. So you have to save up your money, go see the doctor. Make sure you like the doctor and find out the policies and pay for the experience. I think that's extremely important. And that will prevent you from coming back to someone like me to do your second, third, fourth, or fifth surgery, which will cost you a lot more.
Of course. So Dr. Paul Nassif, I would like to go ahead and thank you for joining us today, and hopefully a lot of the viewers at home get to learn a little more about the cosmetic surgery, and hopefully they get to learn about it and become more informed of it. So thank you, Dr. Paul, for joining us today.
Thank you very much for having me.
And we hope that you're going to revisit our studio soon, Dr. Paul. It was a very interesting session with you, and there is so much more that we would like to talk about.
Be more than happy to. Love to.
Thank you. And for all our viewers who would like to connect with Dr. Paul, feel free to write to us on Facebook as well as on Twitter. If you would like to get linked up with Dr. Paul, if you want to know any of his information, to get in touch with him, if you want a consultation yourself, then you can just write to us and get in touch with Dr. Paul Nassif.